Hello, welcome back to another Medicare installment with Maria Shank from Sheridan Benefits. We're so happy to have her join us today to give us the new updates to Medicare for 2024. Enrollment opened on Sunday and and she'll cover that, but it goes for another month and a half or 2 months. And many changes going in. I've seen the news and we're going to cover a lot of those. And we're super happy to have Maria. I'm going to turn it over to you to get us started.
Great. Thanks for having me back again this year. This is the very exciting time of Medicare annual enrollment. As Alan mentioned, open enrollment started on October 15th and runs till December 7th. And in today's presentation, I will be covering the Medicare updates for 2024. We will not be covering plan-specific details, but if you do have questions, you can always contact me to review those options. As Alan mentioned, I am with Sheridan Benefits. We are a local Medicare brokerage firm here in Western New York. We are able to represent 11 different carriers here, covering over 204 plan options. So as you can see, there's a lot of choices out there. So we can help you navigate through that Medicare maze and help you make the right decision. We're going to start off with, just to get things kicked off, for those of you that may be brand new to Medicare, Medicare is the federal health insurance program that is for anybody over the age of 65 that has certain disabilities. You do have to be a citizen or permanent resident of the U.S. in order to obtain Medicare, and you or your spouse would have to have worked 10 years or 40 quarters to receive Part A at no cost. Under Medicare, there are two main portions. The first one being hospital. This is the part you pay into when you work. So when you look at your pay stub and you see that Medicare line, this is what you're paying into, is the medical hospital Part A. This covers inpatient care, home health care, skilled nursing, and hospice care. For 2024, if you are admitted into the hospital and all you have is Medicare, your deductible to walk into the facility is $1,632. That will cover you up to 60 days. If you are in past 60 days, your cost is $408 a day up to 90 days. So this is one of the reasons why a lot of people pick up a plan to accompany their Medicare and don't go with just straight original Medicare only, because Medicare itself does not have a cap on what your out-of-pocket costs were or will be, and it has high deductibles on both parts A and B. So moving over to Plan B, this is literally hot off the press. These were just announced last Thursday. The Medicare Part B premium, the base premium for 2024, is going to be $174.70 a month. It's a $9.40 increase from last year. If your income is above $103,000 for a single person or $206,000 for a couple, you may pay higher monthly premiums for Medicare Part B. This is the portion that covers all your outpatient services. So doctor's visits, lab work, same-day surgery, durable medical equipment, your preventive services. Again, under straight Medicare and Medicare only, there is a deductible annually of $204. After that is met, then Medicare pays 80%, you pay 20%. Couple of things I want to point out is, if you choose to pick up a subsequent plan, such as an Advantage plan or a Medigap plan, you will always continue to pay that Medicare Part B premium regardless. So if you take your Medicare and you go with a Medigap that has a premium, you pay both premiums throughout the time that you have both parts in place. If you don't take out your Medicare at the right time, you could be faced with a late enrollment penalty. and that could be 10% for every 12 months you go without it. So as we go through the presentation, we're going to go through scenarios where you may not have to take it out, when the penalty would be waived, and when you have to take it out so that you don't incur that penalty. One option that you can get to accompany your Medicare, which tends to be a more popular option, is a Medicare Advantage plan. These plans cover everything original Medicare A and B cover. They have no medical deductible. So like we saw on A with the $1,600 plus to go into the hospital, in Part B, the $240, those are offset by these policies. You will not have to pay those plans or those deductibles. The Advantage plans will also cover you for urgent and emergency care worldwide. And this is important because fee-for-service Medicare does not cover you outside the U.S. Most of these plans will include the prescription drug plan built right in. And some of them will even include your ancillary benefits like vision, hearing, dental, wellness programs, over-the-counter benefits. All Medicare Advantage plans have an annual out-of-pocket limit. What that means to you is you are capped at what your financial obligation is going to be for the year. Unlike Medicare, as I mentioned earlier, there is no cap. These will financially protect you if something catastrophic were to happen. Again, you will still continue to pay your Medicare Part B premium if you opt for an Advantage plan. What's very important when you're shopping for your plans is knowing what type of coverage you need for the services you get and where you get them. So 3 main programs out there are your HMOs, which is a health maintenance organization. These are the plans where you do have to pick a provider in your service area. So in most cases, it would have to be right here in the 8 counties of Western New York. If you are going with a PPO, a preferred provider organization, these plans will extend a nationwide network. So if you're going to see doctors in, say, the Cleveland Clinic or the Mayo Clinic, you are on a PPO plan and that provider is in network with that carrier, you will pay in-network copayments. So these are the things you want to have available and prepared when you are sitting down and meeting with somebody so they can help guide you to what type of policy is going to work for the needs that you have. There are plans that are called special needs plans, and those plans are specific for people that live in either a nursing home, have chronic illnesses, or may have certain diagnoses. So there's chronic special needs plans for like heart disease, diabetes. There's institutional special needs plans, which are for people that live in nursing homes or assisted living facilities. And then there is the dual special needs plans, and those would be for people that have both Medicare and Medicaid. So Medicare Part D is very important because this is another portion where if you don't take it out at the right time, you could be faced with late enrollment penalties. For those that are turning 65 or coming off of an employer group plan, as long as you have had coverage all along and there's no lapse in coverage, there will be no penalties if you pick up a prescription drug plan at time of enrollment. So there's 2 ways you get Part D. You get it either through one of the Medicare Advantage plans or by itself as a standalone prescription drug plan. Some people do choose to stay with the fee-for-service Medicare as their primary, or may pick up a Medigap that we'll be discussing here shortly. That's when you would get a standalone drug plan versus having it wrapped right into your Advantage plan. One thing I want to point out is if you see an Advantage plan that does not include prescription drugs, you cannot pick up a standalone prescription drug plan. It will kick you out of the medical plan. So it's either a Medicare Advantage plan or a prescription drug plan. You cannot have both. Whichever one you enroll in second will kick you out of the first one. So again, you just want to make sure that you're picking it up at the right time to avoid those late enrollment penalties. And the Part D plans are not administered by the government. They are administered through the private insurance companies that we have here locally. This is something that is probably the hardest thing to digest for people and probably the most complicated part of selecting a plan. And I know this slide is very busy and very unattractive, but it's my job to make it look pretty and understandable. So there's four main components when you are looking at a Medicare prescription drug plan. So whether it's involved in an Advantage plan or a standalone plan, there's four phases. The first phase is if your plan has a deductible. This is the only time you'll see a deductibles on the drug portion. Some plans will have them on all tiers. Other plans will only have them on your higher tiers like 3, 4, and 5. What that means is you're paying the full cost of the drug on the designated tiers until that deductible is met. Then you go into the initial coverage limit. This is where you pay the plan's copayment. So whether it's $15, $45, $95, you pay that plan copayment until what you've paid and what the insurance companies combine reach $5,030. So for example, if you are taking Eliquis, Eliquis is about a $600 drug. On most plans, it falls under a tier 3 drug. So it's going to be between $42 and $47 a month. You go to the pharmacy, you pay your copayment. The full cost of the drug, that's $600, that's what's coming off of that $50/30. So once you've depleted that number, you enter the coverage gap, or what was formerly known as the donut hole. At this point, you will pay 25% of the cost of all medication. Most plans out there do have tier 1 $0 generic drugs. If you get into the coverage gap, you will begin to pay 25% of the cost of those generic medications. You continue to pay that 25% until you reach that true out-of-pocket amount of $8,000. Now that $8,000 is comprised of everything you've already spent. So if you've spent the $545 deductible, you've spent $530, or excuse me, the $545 deductible, let's say by the time you hit that $50/30, you paid out $2,000. The $2,000 you have physically taken out of your pocket has also come off of that $8,000. Now, when you're in the coverage gap, this is the part that gets a little confusing, because when you go to the pharmacy and you get your prescription drugs, if it is generic, only what you pay at the pharmacy goes towards that $8,000. So if you go to the pharmacy and you get a $4 drug, you're going to pay $1. That $1 goes towards that remaining $8,000. But you go to pick up that Eliquis, you pay 25% of that Eliquis at the pharmacy, but the full cost of your brand name drugs come off of that amount. So that full $600 is going to go towards that remaining amount. So by the end, you're not physically paying out of pocket $8,000. You're only going to pay 25% of the brand name cost towards that. If you reach that $8,000, you'll go into the last phase, which is catastrophic coverage. New for 2024, if you hit that catastrophic coverage, you have no more copay. Okay, so you'll see that, again, there's the different phases. It all depends on your drugs and the tiers that they fall on. As an insurance agent, one of the things I do for my clients is when I sit down with them, I have them bring a list of their medications. We actually run a 12-month drug report to see if and when you're going to travel through these different phases to give you an idea of what your out-of-pocket costs for that year are going to look like. If you are on insulin, insulin has its own category and they are capped at $35. Your insulin cost does not go towards the 50, 30, or the 8,000. It's its own category that has started a couple of years ago to help people be able to get their insulins without issues, without having to pay exorbitant costs for it. So you'll see that if you are picking up that insulin, it will never change. It'll be $35 throughout the whole year. Because of these costs and phases that we go through, there are programs available that can help offset that cost to you. One of them is the New York State EPIC program. This one is based on income. So an individual has to make less than $75,000 a year, and a married couple is $100,000 or less. If you qualify for the EPIC program based on your income, you're either going to be on the fee plan, which means your single income is less than $23,000, married income is less than $28,000. You will pay an annual fee to EPIC. Your co-payments will override those on your plan, and they'll be no more than $3, $7, $15, or $20. If you're above the $23,000 and $29,000, but under the $75,000 and the $100,000, you will have an annual deductible to meet. That's money you're already spending on your prescriptions by paying your plan co-payment. Once you've satisfied that EPIC deductible, you then would go into the EPIC co-payments of $3, $7, $15, or $30. If you are a member of the military and are a veteran and have eligibility at the VA, you could receive lowered co-payments for your prescriptions through the VA. And then we also see if you qualify for the low income subsidy or the extra help. Again, based on income, but we would help you figure out if you qualify in order to lower your prescription drug costs through that avenue as well. When it comes to applying for Medicare, there's a couple of ways that this takes place. If you are somebody that took Social Security prior to age 65, you will automatically receive your Medicare card in the mail 3 months before your 65th birthday. If you continue to work and you're not drawing Social Security yet, and you don't think you want to draw Social Security yet because you still want to work, you would then contact the Social Security office either by phone, online, or in some cases you still can go in person. Not everybody needs to apply, but everybody should at least log into their Social Security account if they haven't done so yet to get yourself prepared. Using the SSA.gov website can be very helpful in deciding whether or not you want to do your Social Security, when you want to do it, and getting enrolled in your Medicare. If you are working past 65 and your employer has less than 20 employees, you will want to pick up your Medicare A and B to avoid penalties. If the employer is less than 20 and you remain on their plan and you do not pick up Medicare, what will happen is the insurance carrier will deny the first 80% of that claim because Medicare should be paying primary. In turn, you're going to get that bill from the provider to pay that 80%. So if your employer is less than 20, 3 months before your 65th birthday, you're going to want to apply for Medicare. Again, either going to their website, calling them, or going to the local office and scheduling an appointment. If your employer is over 20, you do not have to pick up Medicare Part B right away because you're considered part of a large group and the group plan still remains primary to Medicare. If you are enrolled in a health savings account, you do not want to pick up your Medicare Part A either, because once you've enrolled in Medicare, you can no longer contribute, and neither can your employer, to that HSA account. So if you think you're going to work past 65, especially if you have a spouse or children still on your plan and you want to keep them covered, you don't even want to enroll for Part A right now. What will happen is down the road, let's say at age 68, you decide it's time to retire. Your employer will fill out what's called a request for employment verification form. That is telling Social Security that you've had credible coverage through a large employer since you turned 65. That will waive your late enrollment penalty. It will set your Medicare back to the first of the month that you turn 65. It will kick your Medicare Part B in place the first of the month that you no longer have your health insurance coverage. So in a case where the employer is over 20, you will not face late enrollment penalties if you do not apply for Medicare A and B. Again, if you're in a health savings account, you don't want to take that Part A out. If you're not in a health savings account, there is no harm in enrolling in Part A and having it in the system already. When you turn 65, you have your initial enrollment period. It begins 3 months prior to your birthday, the month of, and up to 3 months after. If you enroll in the 3 months prior, your coverage will automatically begin the month of your birthday. If you enroll the month of your birthday or any of the 3 months after, the coverage begins the first of the following month. Every year, during October 15th to December 7th, you have the annual enrollment period, which allows you to make any necessary changes to your policy with coverage beginning on January 1st. Throughout the year, you may qualify for a special enrollment period. That could be coming on or off of an employer group plan, moving in or out of the service area. If you want to enroll in a 5-star plan, you've probably seen a lot of commercials now about different carriers that are 5 stars. If they are, you can switch into a 5-star plan one time outside your annual enrollment period. If you are an Epic member, you can change your plan one time outside the enrollment period. If you have both Medicare and Medicaid, you can change your policy once per calendar quarter for the first 3 quarters of the year. So are you ever locked into a plan forever? No. The most you'll ever be locked into a specific plan is if you don't have a qualifying event to change, you get the plan for 1 calendar year. So lastly here is I want to go over the other type of program that's available, which is a Medicare supplement or a Medigap policy. These work a little bit differently than the Advantage plans because the Advantage plans become primary to your Medicare. These Medigap policies do not. With these policies, Medicare is your primary. As long as Medicare pays the claim, the Medigap policy will pay secondary. You can see any doctor in the U.S. that accepts the fee-for-service Medicare. The one thing you have to keep in mind is these do not cover prescription. This is why you can pick up that standalone drug plan. These plans are also not going to cover those ancillary services like vision, dental, hearing, or gym membership. Again, it's going to cover simply what the Medicare fee-for-service red, white, and blue card covers, and it's going to pick up secondary. Because these plans are not subsidized by the government, they are a little bit more costly, and on average, these are about $200 to $350 a month. And then you top off a drug plan, which is going to run you anywhere from $15 to $60 a month. So we would, we sit down with everybody. We have them bring not only their prescriptions, like I mentioned, but their doctors. We take a look at how often you see each doctor, what types of services you do routinely to help you determine financially which plan is going to make the most sense for you. So that concludes my presentation, and I'm happy to answer any questions if there are any.
I'll open it up first. I do have a few, but I'll open it up to others.
I had a question. How can someone tell, asking for a friend who has a 90-year-old mom, whether they're enrolled in the EPIC?
If they don't have an EPIC card, they can call the EPIC 800 number to see if they've ever been enrolled. If they're not, let me know and I can get you an application for them. But they would be calling the EPIC 800 number to see if they ever had coverage before.
So she would have a card then, basically,
Yeah.
if she's enrolled. Okay.
Correct.
We can go back and forth, Alan, because I have another question too.
No, all right. One of the questions I do have is when you mentioned the premium going up this year, in 2023, it was reduced, right? And then do you remember what the premium was in 2022 to kind of compare 22 to 24 prices? I know it's kind of irrelevant, but I was just curious.
I can
If you
tell
don't,
you.
that's not big.
No, I can actually pull it up here. Just give me a minute. I'm going to do it on my phone only because it'll be quicker than trying to collapse my presentation. I actually have it right on my desktop.
Because what was nice for many people on Medicare and collecting Social Security, they had a nice increase in Social Security, and then a decrease in Medicare, which was nice because they actually got to see a bump up in their Social Security last year.
Correct.
But this year with Medicare or Social Security getting bumped up, it was announced, I think 3.2%, and then the premium jumping back up. So I was just kind of curious to see.
It was 170.10 in 2022.
And it's going up to what, 174?
174.70.
So it's not awful because you got your big increase in Social Security and then a decrease last year and then a smaller increase in Social Security and a bump up in that premium. So I guess in the last 3 years, it hasn't been as bad as previous years where people get an increase in their Social Security, but the Medicare premium goes up just as much. So they never actually see it.
Correct.
So go ahead, Juliana.
You had mentioned when you were talking about the Medicare Advantage that there are plans that are, if I heard it right, or maybe it was the Medigap, so maybe you can correct me if I'm wrong about this. Everything that I've been reading is that the Advantage plans are perhaps not as good of a fit for somebody that travels. So were you saying it's the Medigap plans that are accepted throughout the world or the Medicare Advantage?
They both are. So with the Medicare Advantage plan, if you're somebody that travels, you want to go into a PPO. So you have that access to a national network. A Medigap is going to allow you to see any doctor nationwide, not worldwide, nationwide, that accepts fee-for-service Medicare.
Okay. So if something happens to somebody on most of these plans and they're outside of the country, what typically happens in those instances?
On an Advantage plan, you're covered for emergency care worldwide. I actually had a client a couple of years ago that had a massive heart attack in Munich, Germany. After he came back and everything was settled and done, like, yes, he had to pay and get reimbursed, but he ended up paying a co-payment as if he were sent to a Catholic Health hospital right here in Western New York.
So would you say that the Advantage plans are more generous in their reimbursement than traditional Medicare in that instance?
In most cases, the answer is yes, but it's state specific.
Thank you. That's super helpful.
So welcome to New York. You could probably guess the answer on that one. One of the questions I did have on what are a few ideas that people should consider when choosing which insurance company, especially here in the Buffalo, Western New York area. We have the big three: Univera, Blue Cross or Highmark now, and Independent Health. what's like a main driver, something that they've been used to carrying all these years? Hey, I've always been with independent health. I'd just rather keep it there. Or is it really some of the things that you were saying about, taking open enrollment time to really find out what other issues you might have that weren't covered previously?
That's actually a really good point, because traditionally we used to see people, especially if they were coming off of an employer plan and they've been with the same carrier for so long. The plans there's not many differences between the plans anymore. So people would traditionally stay with the same carrier. Last year and this year, we are actually seeing people more and more saying, I want to see my options. They want to know, even if they're minimal differences between the two, that minimal difference could be the difference they need. So we are seeing people definitely looking at the network, the prescriptions, and what ancillary services each company builds in. Everybody made little tweaks to their ancillary services this year, so somebody may have done something better than what they're getting, so that might cause them to take a look at another carrier this year.
Yeah, I think some people just get so entrenched in, I've been with independent health for so long, or Blue Cross, and I just want to stay. But things change, doctors change, especially.
Right.
I'm hearing more and more like, want more fee for service, and they not accepting Medicare on certain things, and people got to really look out for those options.
Right.
Juliana, did you have another question, or anyone else have a question? I have one more.
I think I'm
good. So when we're talking about, your initial premium of the 174 for your Part B, and as you went through the income levels of each, with the increase in premium, what's considered income to bump up that extra, what is it, $66? And then it's like, it goes really big up to 200, I think.
Yeah, they go based on your modified adjusted gross income for the year.
Okay.
And they look 2 years back. That's the important
2
key.
years.
So if somebody's enrolling for Medicare for the first time in 2024, they're actually looking at your 2022 income.
Now, do they take into account, so say I were to retire this year and I made 100,000 this year, but my future outlook looks like I'm going to only make 40,000 in retirement. Do they take that into consideration, or is all bets off and then you got to wait?
You have to file for it. So you can file for an exception. If you have loss of income is one of the reasons you can file an exception. Like if you sold a house and you made money, you can use that as a filed exception. So people just have to be proactive for themselves to know that there are specific reasons why you can file exceptions, but if you don't fill out the paperwork, they won't just allow you to call and ask for it. You literally have to fill out the paperwork and submit it.
Now, is that through Social Security, or is that through like Center for Medicare, Medicaid?
That goes right through Social Security. It's a form right on their website that's available.
And the look back, the 2-year look back is continuous, right?
Yes.
Yeah.
Yeah. So if you retired in 22 and your income was still high, but then in 23, 24, you start seeing it come down, every year in November, when they do the cost of living adjustment and they redo the Medicare, they re-look at that for everybody. So people's income could start incrementally going down.
But if you know ahead of time, it's better to be proactive to file those forms.
Yep.
So you're not hit with the whole year of extra premium.
Yeah, or work with your favorite Buffalo First Wealth Management financial advisors to prepare for your future.
Well, the reason why I bring that up is because we are experiencing a lot of people that, especially now that they're in their 70s, have to take RMDs, which goes on above your modified adjusted gross income. So now, as you're taking those RMDs, in addition to pension income and Social Security, even though only a portion of your Social Security is thrown back in, but still you could be hit with that extra premium on your Medicare.
Correct.
Now, I do have a few clients that work for the railroad. Is that they're not even close to Medicare yet. They're in their couple of my clients are in their 40s, one's in his early 50s. If they work for the railroad, they don't get Social Security. So do you know if they're billed quarterly for their Medicare premium?
Yeah. Anytime somebody anytime somebody has to pay for Medicare, it's always done on a quarterly basis. Now, they can set up to have it taken out of like a personal account on a monthly basis if they choose to do so, and the directions are on the first bill that they get.
Oh, okay. It was funny. One of my clients didn't realize that he wasn't withholding on Social Security that works for a railroad and doesn't get it. I'm like, didn't you notice all that extra money in your paycheck?
No.
Anyone else have any questions?
This was great, Maria. It's always a good refresher. Appreciate it.
No problem at all. And if you guys have questions along the way, or you get a client that reaches out that you don't have an answer to the question, just let me know. I'm happy to help.
Well, in closing here, is there one thing that we should be sharing with our clients that are 65 and older? I mean, is there one thing that you like, a pain point that you see every year that reoccurs?
Basically, check your prescriptions every year. Formularies change year to year. Tiers juggle, especially if new generics come out and you've been on a brand name for so long. There's a new bill being passed where there's going to be a good number of medications in 2026 that are going to be kept, just like the insulin is. So, just keep your eyes open to what's out there. If you are on Medicare, definitely look at your prescriptions and your formulary to make sure there were no changes, because that is the biggest hit that you're going to take, is if you hit that coverage gap and you're not expecting it.
Very good. Thank you very much.
No
and
problem.
Again, thanks. Does anyone else have a question?
No,
there's a few
not
others
a question, but Maria, thank you very much for all the information that you provide for us. It really, really helps. Okay. And
absolutely.
Please hang in there every year for us.
Yeah. As I tell everybody, I'm not just a pretty face on TV anymore.
There you go.
Well, we are certainly happy to have you take time out of your day, especially this time of year during open enrollment, to spend some time and offer the information to our clients with Medicare, because I think you said it before. I don't know if you said it, but I think you did, or I heard it on TV. The alphabet soup of Medicare is ever confusing, and no matter how many times you hear it, people really need to start educating themselves before they're 65.
Right.
Because it is so confusing.
And I swear there's new acronyms that come out that they add in there every year. So yeah, the earlier you can educate yourself, the better, because it's going to avoid any costly penalties if you do things at the wrong time, and it's going to get you prepared, especially if you're doing it 4 to 5 years before you turn 65. So you know where your income is, and you know where that premium is going to be.
Proper planning.
Yep.
That's for sure. That's what we do here at Buffalo Versus, proper planning.
Yep. And that's why we team up and we make good partners.
That's right. Well, thank you very much. I don't think anyone has any questions. If they do, anyone on the line, please reach out to your advisor, and we can certainly get you in contact with Maria, and her information is listed here. And we will be sending this out. We've had a handful of people that wanted the recording. So as soon as I get that done tomorrow, I will send it to you, and I will also send it to our clients.
Perfect. Well, thank you guys all for your time.
All right.
Thank you very much, and have a great day,
Thanks,
everybody.
Maria.
You too.
Bye-bye.
Bye-bye.